Sur Sanjeevan Music Therapy. Sur Sanjeevan Music Therapy.
I'm Rajendra Dixit, and I am a student of Sur Sanjeevan Music Therapy Trust. As I have learned music therapy under the able guidance of Dr. Pandit Shashank Katti sir. In fact, Dr. Pandit Shashank Katti sir is the backbone of Sur Sanjeevan Music Therapy Trust, and I also have learned medical science during my course of 12 to 14 months from various faculties of the doctors, including neurologist, including gynecologist, including MD Ayurvedas. And of course, when I say music therapy means music teachers were also involved while teaching to me. And today, specifically, why I have come in front of you, because I wanted to express my views in relation to music therapy, because for last couple of months I have been observing that a lot of activities which I have come to know which are going on in relation to music therapy, which are absolutely not scientific at all. Because what I came to know that learn music therapy in 3 months, learn music therapy in 6 weeks, or learn music therapy in 2 months by paying certain amount for learning that particular course. No, absolutely not. It is not like that. Music therapy, which I have learned in Sur Sanjeevan Music Therapy Trust, it is as good as when one becomes a doctor by spending his 5 years for getting the degree of medical doctor. So when one learns under guidance of Dr. Katti sir and under the guidance of plenty of doctors, and he almost becomes a doctorate, means he treats patients, he cures patients, he gives lot of treatment for various disorders of the patient, various ailments of the patients. So ultimately patients are treated through music therapy, which is what we have been guided in Sur Sanjeevan Music Therapy Trust. So my appeal to all of you: don't indulge into such activities of music therapy, because those activities are absolutely non-relevant, non-scientific. So these only I wanted to bring in front of you, and I have expressed my candid views about what is exact music therapy, which I have learned under Sur Sanjeevan Music Therapy Trust. I have learned Indian classical for 6 years, and I have learned plenty of ragas there. One important point which I want to highlight as far as music therapy is concerned, the ragas which I learned 20 years before uh, were different, and the ragas in which I learnt in Sur Sanjeevan Music Therapy Trust, which are called as Suravalis. And those Suravalis, which are used for treating various disorders of the patients, various ailments of the patients. So there is much difference between the two ragas. Traditional ragas, okay, those are Indian classic, this is Indian classical music. But the Suravalis, which what we say boldly in Sur Sanjeevan Music Therapy Trust, those ragas are not raga, those are Suravalis. Those are therapeutic treatment which we use for treating various ailments of the patients. After completion of course, a lot of trials were conducted from my side on various patients, those who were suffering from different ailments. And that project report, which was submitted eventually after completion of that my project, which was submitted to Pandit Shashank Katti sir, and only after his approval, then I have started practicing as a music therapist by taking prior appointments of the patient, and this is how the patients are treated successfully, which I have been treating and in future also I will be treating a lot of patients. So what I mean to say, this is music therapy. So it's a music, scientific music, which is created in Sur Sanjeevan Music Therapy Trust. And therapy is nothing but the treatment which you give. It is after all a medical diagnosis, and after correct diagnosis of the patients, ultimately the specific kind of music therapy is given to that particular patient in order to relieve the symptoms, in order to cure, in order to give the correct treatment to the patients, and this is how the patients are treated. Another important point which I want to highlight is that music therapy is not just to listen music. Music therapy is altogether different. There is vast difference between listening music and treating various disorders through suravalis. You know, general music is for entertainment, and the music therapy through Sur Sanjeevan Music Therapy Trust is for the treatment. So, see, a lot of, on social sites, I have come to know that a lot of pseudo activities which are going on, that learn music therapy in 3 months, learn music therapy in 6 weeks. It is not like that. So, it is, to me, to my mind, I should say that those pseudo activities is like asking any compounder who is working in that hospital, any specific hospital, for treating the patient. Can it happen? No, because he's compounder. How can you call any compounder a doctor? He cannot. It is like that. So all these pseudo activities which are going on, and advertisement which are published in social medias, are like those compounders. So you want to become a doctor, real music therapist, or just you want to become a compounder? Ball is in your court. Thank you.